You can choose your food. You can decide whether to exercise. You can walk away from a cigarette. But there's one thing that you cannot completely refuse. The air entering your lungs roughly 20,000 times in a day. If you live or work in a busy city, the air you are breathing may be bringing invisible passengers. Fine particles from traffic, construction dust, industrial fumes, burning rubbish, cigarette smoke, and even cooking fires. You cannot be able to see most of these, and you often cannot even be able to smell them. But the smallest one travel to the deepest corners of your lungs, and some slip straight to your bloodstream, and this you are not even aware about it. So over the years, the quiet exposure can irritate the airways, worsen asthma, and even invite repeated chest infection, and slowly save away your lung capacity. Here is what I want you to hold on today. You are not powerless. In this video, I will share with you how you can establish your respiratory health baseline, your lung health baseline, and how you can catch early warning signs of your lungs problems before even being able to see the practical things that you can do, which are evidence-based ways you can protect and keep your breath, that it keeps you alive. So I will be very honest with you from the beginning that this is not a lung detox. In this video, we are not going to talk about do not drink herbs, do not eat this, no breathing tricks. But we are going to look at ways that you can help your lungs to live healthier, so that I give you something powerful that will help you reduce what gets into your lungs and also support the clearance system of your body that it is already built in, and they catch diseases before they take root. I'm Dr. Joshua Derito. I'm a family physician. I have interest in cancer prevention and treatment. So take a deep breath, relax, and let's look at your lung health. So when you look at the air you are breathing, what are you exactly breathing? Picture a one morning commute, the matatu idling ahead of you, the construction site that you pass by, the roadside fire that someone has already lit at dawn. Each one of these is releasing something into the air that you are about to inhale. And these are things that you cannot foretell, you cannot prevent. Urban air is a complex cocktail, and one of its most important ingredients is the particulate matter, what has been thrown into that air. What we call the particulate matter 10, particles that measure 10 micrometers or less, very small particles. They enter your respiratory tract and they irritate your nose, throat, and even the larger airways. The particulate matter 22.5, these are far smaller, so small that they slide past your defenses into the alveoli. The alveoli are the most tiny parts, the head parts of your respiratory system, the tiny airway sacs where oxygen enters your blood. Some of their components can cross the lung barrier and entirely stir up inflammation elsewhere in the body. Remember, inflammation is the body defense system, which is characterized by pain, heat, swelling, and increased blood flow. So, and the particles are only part of the story. Urban air can also carry nitrogen dioxide from vehicle exhaust and combustion, ground level ozone, sulfur dioxide and carbon monoxide, construction and road dust. We are all aware about this, especially when it is dust like now. And then smoke from rubbish, charcoal, firewood, and even tobacco. Then we also have industrial chemicals and fumes. And then allergens, we have mold spores and also biological particles. These are possibly pollen from plants and other flowering plants. Here is what surprises most people. The exposure does not stop when you close your front door. Indoors may also be breathing cooking smoke from your kitchen, secondhand tobacco smoke if you live with someone who smokes, incense, mosquito coils, mold, dust, cleaning sprays, fumes from poorly ventilated stoves. All these are there. So your lungs experience a combined dose from the road, from the workplace, and even your home place. So how does pollution quietly change your lungs? Your respiratory system was built with impressive defenses. The hairs in your nose, they filter the particles, and the mucus traps the contaminants that are in the air you are breathing. Then you have microscopic hair-like structures called the cilia. They move backward and forwards, and they sweep the mucus upward so that it can be coughed out and swallowed with any particle that might be trapped there. So we also have an immune system that lines your airway, and this immune system patrols the deeper lung and remove what might slip that upper airway protection system. But then you need to realize that every defense has its own limits. Repeated exposure to oxidative stress and inflammation will make the defense mechanism to give in. The airway lining becomes irritated. Some people produce more mucus. Airways grow more sensitive and narrow more easily because of that persistent exposure and the oxidative stress and inflammation that forms. So for a person with asthma, one bad day a day can mean wheezing and an attack because of the trigger of that protective defensive, making the airway narrow down. For a child whose lungs are still under construction, chronic exposure to this pollutant can mean never reaching full adult lung capacity. Because of that exposure, the persistent triggers, and this brings problems and in the maturity of the lung for this child. So for adults, long-term exposure is associated with lower forced expiratory volume and the forced vital capacity. These are two key measurements that from a test called spirometry, where you blow air, you breathe in and blow a tube that measures how much air you are able to blow out when you have inflated your lungs to their maximum. And it measures how much air you can forcibly push out in the first second. The vital capacity measures the total you can exhale after your deepest possible breath. And here is the part that should concern you. The decline is not invisible. It's often not visible. It's invisible. So people adjust without noticing. When these small damages are happening, because you are not realizing anything is happening, your lungs will start adapting. And because of the damage that is happening, then you also start behaving in ways that you are able to cope up. One of the ways is walking a little bit slower so that your demand for oxygen goes down. This quietly, people who quietly avoid the stairs, they call it aging, or you are not realizing that you are becoming unfit. So your body will whisper before it screams, and you may not notice the whisper unless you listen very carefully. So that is why you need a baseline. So how do you establish your respiratory health baseline? Your baseline is not simply how you feel today. It is a record of your system, of your symptoms, your exposures, and even objective lung performance. You can ask for your lung performance be examined or assessed. Something you can compare against next year and the year after. So, step one, review your symptoms honestly. Ask yourself, are you finding yourself coughing repeatedly? Do you find yourself producing excess phlegm most of the days? Are you having episodes of wheezing? Are you having breathless episodes when you try to climb stairs? Do you wake up at night coughing or struggling to breathe? Does exercise trigger coughing or chest tightness? Or do my symptoms worsen when I'm on traffic or dust or cold air or at work? So when do you find yourself coughing, having chest congestions, things that you can see this is not completely right? Do you have repeated chest infections? And have your walking speed or exercise capacity quietly dropped? So remember that a persistent cough is not automatically to be blamed on pollution. It could be asthma, it could be tuberculosis, it could be chronic obstructive pulmonary disease, especially if you are a smoker. It could also be a symptom of reflux if you are persistent reflux. A cough would also be a sign of a heart disease. Sometimes medication side effects. I have seen patients coughing persistently, and we just need to change the drugs and the cough goes. Or it could be a cancer. So any cough or any symptom that you have that has persisted, you need to see your health provider. Don't just assume it is pollution. So the next step that you need when you are trying to evaluate your lung performance is map your exposure. So for 1 week, simply record where time goes, and you pay attention to one, time besides congested roads, commuting with windows open, dusty construction areas, burning rubbish around where you work, tobacco or pipe exposure, charcoal, kerosene or firewood cooking, mood and dampness. And you can even check your house for mood areas and damp areas in your house. Then occupational dust where you work, chemicals or fumes. Then exercise routes where high pollution zones could be a risk. Most people stand by this exercise when you try to evaluate where you are working and what are some of the pollutants you could be coming across. So exposures become so normal that we stop seeing them. It becomes part of your routine. Like you pass somewhere where they are always burning rubbish and smoking, then you think that is normal. So that's step number 3 in evaluating your lung health. Measure what needs to be measured. So a home peak flow meter can help some patients with diagnosed asthma track their stages and their response to their medication. It does not replace clinical evaluation. You always need to have a scheduled visit with your health provider. If you have persistent symptoms and the occupational exposure, a smoking history, a recurrent wheezing, unexplained breathlessness, talk to your clinician about doing a spirometry to see how your forced expiratory volume is and also how your vital capacity is. It can identify obstructive patterns and monitor also known diseases. When you do this, they can help you know how you are responding to the treatment that you have and show you whether you need further testing or if your drugs are adequate. A pulse oximeter, the one we put on the fingers, it measures the oxygen saturation. A normal does not prove that you have healthy lungs. Early asthma, early chronic obstructive pulmonary disease, and mild lung function decline can all hide a perfectly normal oxygen saturation. So it does not mean that you are breathing okay when you measure your oxygen is okay. So I will share with you now the critical part of this discussion. 7 ways to protect your respiratory pathways. So stay with me because the 7th one could be the most important that you need to pay attention to. So, number 1, pay attention to the quality of air you are breathing before you begin your day. So, you already check weather before traveling. So also, I invite you to treat air quality the same way. Where monitoring is available, use a reliable air quality platform. Look especially at the particulate matter of 2.5 and also the air quality index. Air quality shifts by location and time of the day. Like the rush hour traffic is more if you are walking along a roadside and you expect there will be traffic jams, then the air pollution you expect it to be more. So if you are jogging, then those will be not the right time to follow those kind of routes. Then also weather, dust, when possibly people are cleaning the town, possibly early in the morning, and the dust is in the air, possibly considering ways you can protect yourself, burning of waste, and industrial activity, all create temporary peaks. So when air quality is poor and you expect that some of these things might be happening, so shorten the intense outdoor sessions. Exercise indoors when you can. Shift your workout away from peak traffic hours, as I've said. Then you can choose a quieter route when you expect that there will be pollution, like from the traffic jams, people burning rubbish. When you use a particular route, then you'll know the behavior of the environment that you work in. Then reduce prolonged roadside use, especially if you are going there, for example, for your exercise. And then also take extra care if you live with asthma or chronic obstructive airway disease, or if you have a heart disease. You need to protect yourself. So please do not stop exercise. What I'm saying is that in most of the urban setting, regular physical activity remains one of the best things you can do, but only look for areas that will be safe and that do not expose you to unnecessary air pollution. So adapt the where, the when, and the how, not whether. Exercise is a must. You do not stop exercising because you put yourself uh, at a bigger risk. And another way, put distance between yourself and traffic. So pollution is usually most concentrated at its source. So walking route pressed against a congested traffic can expose you for more pollution than a parallel street, a park, or a residential road just minutes away. So if you can, avoid congested road when you can. This matters more, especially when you exercise, because when you're exercising, you multiply the volume of air you pull into your lungs. So you don't want to get most of that air from polluted environment. Also, do not avoid standing directly behind idling buses, lorries, or diesel vehicles that are releasing plenty of fumes. And when driving through a heavily polluted stretch, then close the windows and switch your ventilation to recirculate. And then restore fresh air flow when conditions improve. Then number 3, create a cleaner air room. You cannot clean an entire city today, but you may be able to transform the one room where you spend 8 hours every night. So keep smoking and fighting completely outside your home. Skip incense, things like candles when you don't need them, and any burning in closed rooms. This might harm your air. Also, ventilate your kitchen properly and deal with the dampness or visible mold. This one you need to keep checking your house for moldness. And when outdoor pollution spikes, close the windows, especially those facing the pollution source, especially if like you possibly, if where they burn rubbish always close the windows so that you avoid the smoke and the dust coming into your house. So if it is within your budget, use correctly sized portable helpers, air cleaners, and match the unit to the room size, and also avoid any device designed to intentionally generate ozone. So one firm rule, an air purifier is never permission keep smoking indoors. So avoid smoking inside your house. And if possible, if you must smoke and you are struggling to stop smoking, do not smoke in your house and make sure that you have smoked 30 minutes before getting into your house. So this helps you save yourself and also save your family members. Ah, Point number 4, use the correct mask for severe particle exposure. A loose surgical or a cloth mask may feel protective, but fine particles slip easily quickly around its edges. When we are talking about particulate pollution sphere, then you need an N95 mask or a KN95 or an equivalent respirator. These can genuinely reduce the particle size exposure. The secret is the fit. It has to fit air. It has to fit nicely. Air should pass through the material, but not leak around the side. So it should fit you nicely. Facial hair can also break the seal and affect the effectiveness of the mask. So remember, what respiratory do and don't. So they filter particles. They do not block every harmful gas, and they never replace even a dangerous environment when you can. So if you have a severe heart disease or a lung disease and you struggle while wearing a respirator, seek with your health provider. He will give you personalized advice and also treat any condition that needs medical treatment. Point number 5, keep your natural clearance system working. How do you do this? Your lungs already learn a clearing service. The mucus, the cilia, and the immune system, they work around the clock to protect you. So how do you help them work to protect you? You support that system. One, when you avoid smoking and vaping, you drink enough fluid to prevent dehydration. Because again, dehydration dries your mucus, and this puts you at more risk of getting particles into your system. Then stay physically active. Exercise helps you, your breathing system. Treat asthma, treat allergies the right way. And then keep the recommended vaccination current. And then manage respiratory infections properly and also follow occupational safety measures. So a general reality check. Hydration supports normal mucus consistency, but drinking extra liters of water does not wash pollution from your lungs. So steam may briefly soothe your blocked nose, but it does not detoxify anything. So very hot steam can also burn you and destroy your mucous membrane. So avoid these extremes. Then the 6th point, clear the nose appropriately when appropriate. So your nose is the front door of your respiratory defense system. If pollution, dust, or allergies leave you congested, sterile saline spray or a correctly prepared saline irrigation may bring relief from symptoms. So, but safety is non-negotiable. So for nasal irrigation, use only sterile distilled or previously boiled and cooled water. Never use untreated tap water because remember that this could bring infections and introduce contamination to your nostril. Keep the device clean and do not share these nasal sprays. Then keep the explanation and keep your expectations honest. Saline cleansing clears the nasal cavity, but it does not reach the lower lungs. So do not use like a detox. Just do what is physically possible. Then, if your blockage is one-sided and it has become possibly blood or sphere or persistent, do not treat yourself. Get evaluated by your health provider and get the appropriate treatment. This might save you a serious problem. Then the seventh point, train your respiratory reserve. So regular aerobic activity teaches your heart, your muscles, and your respiratory system to use oxygen more efficiently. So walking, cycling, jogging, swimming, and structured aerobic exercises, they help you have a healthy heart, healthy lungs. So choose what suits you and what you can do consistently, and it fits your health and your stability. So strength training also helps you to build strong muscles, and it means that strong legs means you can be able to climb stairs when there is demand, and a smaller slice of your maximum capacity is supported by healthy muscles. So for moments of breathlessness, you can use past sleep breathing, where you just try to push air in. So breathe in gently through the nose, and then lightly past lips for about 4 seconds. You breathe out. Don't force it. So these techniques can help people with the chronic obstructive pulmonary disease or people who have anxiety. This rapid breathing can help you regain your control, and it does not enlarge your lungs or enlarge or remove deposited particles, but repeated many times can help. If it makes you feel decent, then stop, breathe normally, and if you're not sure, you feel unwell, see your health provider. So these are some of the things that you may do that are not really helpful uh, in your day-to-day life. One, let's clear the air on a few minutes. There's no special juice that removes particulate that matter from the alveoli. You cannot be able to say you are detoxing. There's no herbal tea proven to reverse pollution-related lung damage. There's no supplement that makes smoking or heavy pollution safe. Steam cannot reach inside your lungs and scrub them. So don't think because you are inhaling smoke or steam, you are going to detoxify your lungs. Forceful coughing without a medical reason only irritates the airway. And holding your breath tell you nothing reliable about your lung health. So antioxidant-rich food belong to a healthy diet, but no food on its own neutralizes unhealthy air and the unhealthy environment. The most effective intervention will always be less exposure. The better you can reduce the exposure to harmful environmental pollutants, the better for you. So be able to control the source, improve the ventilation and the filtration of harmful particles, and protect yourself when exposure is unavoidable. And then treat established disease the right way. The support for the whole system with movement, sleep, vaccination, and nourishing food cannot be overemphasized. It is the core of healthy living. So prevention is not expensive, but neglect is. So who needs extra protection? Urban pollution touches everyone, but some people carry a heavier burden than affected. We talk about children and teenagers, expectant women, older adults, people with asthma and chronic obstructive airway disease, people with heart disease, people who are working outdoors, traffic officers and roadside traders, construction and industry workers, people exposed to cooking fuel smoke, current and former smokers. They have more risk to pollution and more risk to lung problems. So children breathe more air relative to their body size because they tend to breathe faster to be able to cope up. So play actively though also, and they have lungs that are still under development. So we need to protect them. And for outdoor and the open air workers who are exposed for hours every single day, personal protective equipment and employer level source of control are not luxuries. They are rights, and we also need to protect those people who are persistently exposed to pollution. So, what are some of the warning signs that you need to get medical attention? So, if you see these, then seek medical attention urgently. If you have severe difficulty breathing, blue or gray lips, confusion, fainting, or extreme drowsiness, if you have chest pains, if you are coughing blood, if you have inability to speak or complete sentences, if you have asthma worsening rapidly despite the prescribed reliever, if you have low oxygen saturation with symptoms, allege for medical review, if you have a cough that is lasting for 3 weeks, if you have recurrent wheezing or a persistent sputum production, if you have unexplained weight loss, if you have night sweat or fever, if you have repeated chest infection, if you have progressive breathlessness, or you are having difficulties when you try to exercise. And in Kenya and the other high tuberculosis countries, the burden is significant. So a persistent cough with fever and night sweat with the weight loss, you must be able to be screened for TB. Just dismiss it as pollution. TB could be a possibility. Get screened, get medical attention. So you may never control every vehicle or factory or construction site or cooking fire in your city. But far more, you can be able to control many things that you can think. So it is good you know where your baseline is. Check your air, change your route when you can, protect your indoor sanctuary. Wear a proper respirator when exposure is severe. Keep exercising, just use cleaner times and cleaner places, and never ever ignore persistent respiratory symptoms. Your lungs are quietly working for you. They do not demand attention with every breath, but sometimes they can compensate for years before the damage announces itself. So protect them from breathlessness. Do not assume that this is your new normal. It could be a medical problem. So let me leave you with one question to carry into this day and into your daily routines. What is the biggest avoidable exposure entering your lungs every day? What can you take control of? You may not control very many things, but there may be one thing that you can start today and keep improving the air you breathe in. Identify that thing that you can be able to avoid and reduce it. And if this video has helped you, share it with someone who lives, works, or walks or exercises near busy roads. Subscribe to Community Wellness Channel today for evidence-based guidance that helps you control your health before diseases take control. If you want and you are ready to build healthy habits with structured support, then the Health Insight 360 program is for this. And you can get the link in the Wellness Health Services website. Breathe well. See you in the next video. Thank you for watching.